Well, breaking health news your family needs to know tonight about a health crisis affecting our state. Good evening, I'm Nadine Woodward. 36 people in Spokane now have the mumps, and some kids who haven't been immunized against the disease will not be allowed in school for weeks at a time. First now to the numbers. As of this afternoon, Spokane County has 36 probable and confirmed cases of the mumps. That's up just 5 from yesterday. Statewide, nearly 200 people have the mumps right now. In fact, it's the state's worst outbreak in decades. So let's get straight to KXLY4's Grace Ditzler. She's working for you. And Grace, dozens of students will be forced to leave school starting next week.
Right, Nadine. It has to do with what are called exclusions, which is a policy to protect the unvaccinated. The health district says in the event there are multiple cases at a specific school, kids who have not had the vaccine or can't otherwise prove they're immune or have health conditions preventing them from being able to get the vaccine will be asked to stay home from school for up to 25 days, starting 12 days after the first exposure at that specific school. 36 cases of mumps and climbing.
For Spokane County, certainly mumps here is pretty rare for us.
The majority of those cases are people under 20 years old.
When we're in outbreak status like this, when we hit certain thresholds, the health district has to make a determination if we need those unvaccinated kids to stay home.
Spokane Public Schools confirms that will happen next week at Rogers High School and Regal Elementary School. East Valley School District says an exclusion will start at Trent Elementary on Tuesday, and exclusions are in the works at least one school in the Meade School District. The health district says kids with no evidence of immunity are excluded. That means those kids have not received 2 doses of the MMR vaccine or have not proven their immunity through a blood test. Once they're excluded, those students are required to stay home for up to 25 days. If another case is discovered, that 25-day period starts over.
Because they are at greater risk for contracting that disease, and mumps can have some serious complications.
The health district says staff at these schools have a window of 10 days to prove they've had the MMR vaccine or are immune. The health district says because of the way mumps is spread through close contact, people are more likely to catch it at home than at school.
Through our case investigation, we can confirm that many of these individuals are close contacts of each other, family members, people that spend a frequent amount of time in each other's households.
But the health district says the best thing to do, check you and your kids' immunization status.
So the call to action for our community is to ensure that you're up to date with your MMR vaccination.
It's important to note if you have not received a note from your school and the health district about mumps at your child's school, that school is not currently affected. Families and staff at affected schools have all been notified, and school districts and the health district will notify schools if mumps cases are confirmed at other schools. We'll keep you updated as this story develops. Reporting in studio, Grace Ditzler, KXLY4 News.
Thank you, Grace. And here are 4 things you need to know about the mumps. It is a contagious disease caused by a virus. Symptoms include fever, headache, muscle aches, and a swollen jawline. In kids, it is typically mild but can be serious in adults. And in the worst cases, mumps can cause deafness, miscarriage in the first trimester, even meningitis.